Now, taking a closer look at the left and right lungs respectively, we're going to be looking at their mediastinal surfaces, also known as the hilar regions. The reason we're going to do this is because each lung is associated with various different grooves and structures, and that's what we're going to go over, not only to see the similarities between the left and right lung, but to see the differences. Starting with the left lung has an oblique fissure. The oblique fissure of the left lung separates it into the left upper lobe and the left lower lobe. A common or important notable characteristic of the left upper lobe of the left lung, which is created by the oblique fissure, is the lingula. So the lingula is a tongue-like structure that is an extension of the left upper lobe. Sometimes it is commonly confused to be a part of the left lower lobe because it's on the inferior aspect of the upper lobe, but it is important to note that the lingula is of the left upper lobe. Aside from the lingula and the oblique fissure separating the left lung into upper and lower lobes, we have various different grooves. Now, these different grooves are going to be for the different structures on the left side of the body. And if we think about the heart, the main arterial structure branching or coming off of the heart is going to be the aorta. And the aorta has an ascending and aortic arch and descending portion. Now, the portion that's going to be associated with the lungs is that in which is going to be going down or inferior towards the diaphragm. And that's going to be the descending thoracic aorta. So the left lung has a groove for the descending thoracic aorta. And that's because that descending thoracic aorta sits on the left side of the heart. Now, the structure, the blood vessel, kind of analogous to the descending thoracic aorta on the left, but talking about the right side, it's kind of going to be that azygous vein. So that azygous vein is going to be on the right, whereas that descending thoracic aorta is going to be on the left. And therefore, the groove for each is going to be on each left and right respective lung. Now, before the descending thoracic aorta, or before the descending aorta in general, we have the aortic arch. Therefore, the left lung is going to have a groove for the aortic arch on the superior aspect of the hilar region, or mediastinal surface. And that continuation of the groove for the aortic arch is going to give us the groove for the descending thoracic aorta.